Hi and welcome. I'm trying to learn medicine today, Achalasia of Cardia, and after we've done it, we're going to do backstretching, and if you participated in the backstretching, then especially on risk. And this is part 2 of the Achalasia of Cardia, and this is no medical advice, we're just learning about it, and we're talking about internal anatomy and a disease and an illness. Achalasia of Cardia is a rare disease in which the muscles of the esophagus or gullet fail to work properly. I think it is spoken of the esophagus. Maybe it is not the esophagus, but the esophagus. I think it is the thing through which the food from the mouth comes into the stomach. Normally, when food is swallowed, these muscles automatically set up a wave-like movement. The muscles of the esophagus. A wave-like movement to the esophagus. Achalasia of Cardia is a rare disease in which the muscles of the esophagus fail to work properly. Normally, when food is swallowed, these muscles automatically set up a wave-like movement to the esophagus that pushes the food down towards the stomach. The sphincter, that is a muscle ring at the lower end of the esophagus, relaxes and lets the food through. In achalasia, the esophageal muscles and sphincter do not respond to a swallow, and so food and saliva are retained in the esophagus, which becomes swollen. Okay, the muscles of the esophagus do not start with a peristalsis movement, which pushes in a wave-like movement the food down into the stomach. Now, by Achalasia of Cardia, I'm trying to learn it now and present it now. The swallowing doesn't ignite the peristalsis movement and relaxing of the sphincter at the end of the esophagus, and the food stays in the esophagus together with the saliva, and that causes the esophagus to get swollen. Symptoms of difficulty in swallowing liquids and solids. We want to concentrate now, we're preparing a little presentation. We want to concentrate on the disease itself, not so much on the treatment. Difficulty in swallowing. Food felt to be stick behind the breastbone, chest pain. The symptoms are from chest pain to a feeling of the food got stuck, and to difficulty of swallowing. Regurgitation of undigested food and saliva. And food and saliva may be breathed into the lungs, especially when the patient is lying in. This causes cawing, breathlessness, and chest infection. We're going to do it. We're going to concentrate on these parts mostly. And the food can be breathed in a bit into the lungs, and it can cause cawing, breathlessness, and chest infections. Cawing, breathlessness, and chest infections. Cause now known as no cause is known, but this book is from the 80s. It can lead to pneumonia and bronchiectasis. We had bronchiectasis. What was that? It was an increase in size of a bronchi. Bronchiolitis is inflammation of the bronchioles, and bronchitis is inflammation of the bronchi. Now, what is it now? We have to do one video and where we're going to say what is what. Bronchiectasis, an increase in size of the lungs. Bronchitis, inflammation of the bronchioles, and bronchitis, inflammation of the bronchi. Bronchioles, bronchiolitis, and bronchitis, bronchis. Bronchis, bronchitis, bronchioles, bronchiolitis. And bronchiectasis, whatever, increase in size. It can cause pneumonia, bronchiectasis. So, bronchiectasis, pneumonia, bronchiectasis, and an increased risk of esophageal cancer. Treatment in the home, do they say eating smaller meals, sitting up, take frequent drinks in small quantities? We're not going to say these treatments. If the symptoms persist longer than a week, then consult a doctor. Exclude more serious causes when done. X-rays. Examination with an endoscope. maybe treatment may require an operation to cut or stretch the muscles at the lower esophageal sphincter in order to allow food to pass into the stomach. Prevention, none is possible. Outlook, reasonable, good with treatment. So we have one treatment here. Treatment may require an operation to cut or stretch the muscles at the lower esophageal sphincter in order to allow food to pass into the stomach. We're not going to say that. Okay, what we're going to say is, first there is the esophagus, and through that the food comes from the mouth into the stomach. And normally, and by Achalasia of a Cardia, the swallowing doesn't properly ignite the peristalsis movement, which in a wave-like movement pushes the food down and through the sphincter, we have to name it also, the muscle during the sphincter at the end of the esophagus, into the stomach. And that can lead to a feeling of chest pain, of food getting stuck. Yeah, but it's actually with the food and saliva is retained, and it leads to a feeling of food getting stuck behind the breastbone, chest pain, difficulty swallowing, and regurgitation, and it can be breathed and then through the trachea into the lungs, and that can cause cawing, breathlessness, and chest infections, and complications of that all Achalasia of the Cardia is. So that would be, let's try it again, that the swallowing doesn't, that's not really the problem. I think the problem is somewhere in the trachea. That's why the operation, the cut of the sphincter. The swallowing doesn't properly ignite the peristalsis movement of which the food is pressed down, and but the peristalsis movement isn't properly done. Now, what is now actually the problem? Is it just the sphincter? Can't be properly done. The sphincter at the end, and the sphincter at the end is not relaxing. It's not relaxing, and doesn't let the food properly pass through. Causes also for unknown, as well as any prevention measurements. There are treatments like advising to eat smaller meals, sitting up, and possibly surgical operational, to make a cut or stretch at the sphincter at the end of the esophagus. Now we're 7 minutes in. We have just time for one take. We don't want to do it under pressure. So we're going to do it next time. If you're here for medicine, then you can go directly to the next part of medicine, where we will try to say what I just said down in one presentation, record it in a separate video, and publish that separate video separately, and have it for us ourselves, so that we have this information here in audio and video format with our own words. If you stay here and participate in the backstretching, then it's better at your own risk. Good, and step it stands. And we're bringing the arms up. And breathe out, we're going over to one side. Breathe in. And out, back into the middle. Again in. And out over to the first side. Breathe out, middle cage. And breathe out into the middle and the arms down. Now no one sees the Achalasia. Breathe in. And out in one hand slides down the leg. And wherever shoulder stays down. Breathe again in. And out, and we're taking one arm over. Breathe again in and out, middle cage. And out, back into the middle. Breathe again in. Out, one hand slides down the leg. The other shoulder stays down. Breathe again in. And out, we take one arm over. Breathe in and out, middle cage. And breathe out, back into the middle. Next exercise. The aeronautic aerobatic aeroplane. Feet are standing together. Breathe into the arms. And breathe out, one hand down. Breathe in and reach. And breathe out. Again in. Out the other hand down. Breathe in and reach. And breathe out. Next exercise, the feet are keep standing together, breathing in, lifting the arms up. And breathe out, arms down, open the chest to the sky, the crab in the morning. Breathe in the arms up. And breathe out the arms down. Breathe in the arms up. And now the hands together and breathe out and lean back, release and bend. Breathe in into the middle. And breathe out, leaning it back. Breathe in into the middle. And now out, lean to the side, a third movement. Breathe in into the middle. And out over to the other side. Back again. And now we're doing screw, intertwine the fingers up across the arms and reach high. Breathe in. Breathe out. Intertwine the fingers the other way around. Breathe in and reach high. And out the arms down. Now the Marco. Legs shoulder width apart. Breathe in, lift the arms up. Breathe out, go back, grab in the morning. Draw the shoulder blades together. Breathe in the arms up. Over cross the arms, intertwine the fingers to reach high. Breathe in. And breathe out, reach in front and all over back. Again, in the arms up. And out and down. Again, in the arms up. Across the arms, intertwine the fingers reach high. Breathe out, reach in front, all over back. Again, in the arms up. And out and down. Feet are standing together. We're doing a skyhugger. Breathe in the arms up. And breathe out, lean back, open the arms wide to the sky. Breathe again in. And out and lean again back. Breathe in the arms up. And breathe out the arms down. And we're ending with the cactus connecting instincts. Breathe in the arms up. Bring the hands to touch and now the hands down. That was the backstretching. I thank you very much and until next time.